Hi, I'm Dr. Mark Poray, a chiropractor in Whitby, Ontario, and today I want to talk about disc herniations. What are discs exactly? Well, they're the compressible part of your spine. There's a disc located between each vertebra, except at the very topmost, above and below the C1 vertebra in the neck. That's the only place where there isn't a disc. The job of the disc is to provide cushioning from shock, vertical motion, and to provide nourishment to the vertebral bodies. The disc is made up of an outer ring called the annulus fibrosus and a central portion called the inner gelatinous, the nucleus pulposus. The outer rings are actually constructed of concentric bands of alternating fibers that run perpendicularly in order to provide more strength. So you've got fibers running in this direction in one band, and the next band in they'll be running that direction, and then the opposite direction, and so on all the way in. Occasionally, as a result of some sort of an injury or wear and tear, there'll be some sort of damage to the bands somewhere along there. In this case, we've shown a tear in one or two of the bands, and that creates a weakness, which then allows the nucleus to push its way into that weakness, and that will create a bulge, which then presses against the spinal cord or the spinal nerve and may create some of the symptoms that you feel. So in this diagram here, you'll see that this is a normal nucleus inside of a disc, and here's the normal spinal cord with the nerves running out, and there's no contact. With a disc herniation or a disc bulge, the disc pushes its way into that area, and the disc contacts the nerve and creates some of the symptoms that you may feel. There'll be a variety of these symptoms. They could range from loss of strength to numbness to weakness, and so on. There's actually 3 different kinds of disc bulging. 95% of them actually occur at the L4 and the L5 discs. So almost every one will occur at the very bottom. The first type is the bulge, which is quite small and may or may not press on a nerve and may or may not create any symptoms. So there's the first one, where the weakness pushes out towards the nerve and may or may not contact it. The second one is the disc protrusion or disc herniation, and here a portion of the disc may actually contact the nerve root, and it will cause symptoms that may go into the neck, or it may go into the back and into the legs. And the third is the sequestered disc, where the piece will actually separate itself and float in the spinal canal, either causing symptoms periodically, or it may sometimes spontaneously become resorbed by the body. So the pain associated with the condition is not from the disc itself, but rather from localized inflammation. Localized inflammation will be comprised of swelling, heat, redness, pain, and loss of motion. Now, in order to treat this, we have to know the location and the extent of the problem, whether it's a bulge, a protrusion, or a sequestered. And the doctor can get a good idea if there is a disc problem by simply doing a few tests, like the Valsalva maneuver, or a straight leg raise, or the back flexion test, among other things. The location can then be determined by a few other tests, like reflex tests, strength testing, or testing sensations in different parts of your body. But to absolutely confirm the extent and the location, an MRI really should be done. So can these discs heal on their own? Well, the short answer is yes. Most will become symptomless on their own within 1 to 6 months. The question is, can you wait 6 months? In fact, more than 90% will heal without any kind of surgery. So, if you don't want to wait the full 6 months, then you may want to do something to help it along. Can chiropractors be part of that? In general, chiropractic manipulation, the standard chiropractic maneuver, is not suggested because any rotation can actually worsen that condition. However, there are alternatives that chiropractors can provide. One of them is mechanical or manual, light manual distraction, pulling the vertebrae apart. Gentle separation of these vertebrae will assist the body to draw the disc back in, kind of like a fountain pen effect. Cold lasers and ultrasound can also aid in dissipating inflammation. Interferential and microcurrent are very effective in helping to control pain. Acupuncture is quite helpful. And the use of the neuromechanical impulse gun can stimulate localized pain modulation and aid in manipulating the vertebra without actually causing any torsion on the segments. So what kind of things can you do to speed up the healing? Well, first of all, we have to avoid things that will aggravate the problem. So, one, we try not to create any activities like sitting for long periods of time. We want to avoid any twisting movements back and forth. Don't sit or lie in soft chairs or beds. Do not lift anything heavy or awkward. And try not to combine lifting with twisting. If you have to do that kind of maneuver, pick up the item close to your body and move your feet to get it around. I should also warn that heat is not to be applied in an acute low back injury, which might be a disc, because that will make the inflammation worse. So the second thing are exercises. Which exercises can you do to help this along? Well, remember that depending on the location of the bulge, some of these exercises may actually be painful. If we have, for example, our bulge on this side and we do some bending to that side, we're going to create more problems on that disc. So, before you do any of the exercise that I'm about to suggest, check with your family doctor or your personal therapist to make sure that they're okay for you. The first one is done lying on your back. Bend your hips and knees, place your hands behind your knees, and pull your knees towards your hips and hold that for about 15 to 20 seconds. If you're lucky enough to have a Swiss ball or an exercise ball, lay on it on your stomach and gently roll back and forth. The third exercise is standing and gently bending away from the side of the pain and hold that position again for 15 to 20 seconds. Another exercise is lying on your stomach, alternately raising your left leg from the hip, holding for 5 seconds, and then the right leg for 5 seconds for the count of 5, and do that 5 times with each leg. Finally, remember that whenever you're doing any kind of bending at the waist, try not to curl the low part of your back forward. Rather, bend from the hip joint forward to take the stress off of that disc. That's all for today. I want you to remember this is not a condition that affects old people. This is most commonly affecting people who are between 20 and 40. And that's because people between 20 and 40 seem to be the most active, and certainly by the time you're older than that, the discs have lost a lot of their pliability and tend not to bulge quite as much. So that's not to exclude anybody else, but the most common people to become injured with discs are 20 to 40 years of age. If you suspect that this has happened to you, check with your family chiropractor or your family doctor, and then go from there. I'd invite you now to explore my website at www.drporay.com, or call my office to make an appointment at 905-655-5600. 5767 at the Brooklyn Family Health Center on Highway 12 north of Whitby. Thanks for your attention today.